In this video, you will learn the proper technique for preparing an AngiosculptEvo PTCA scoring balloon catheter. Prior to preparing the balloon, a 0.014-inch coronary guide wire should be positioned beyond the target lesion. In the case of pre-planned stenting, select a catheter that is one size smaller relative to the estimated reference vessel diameter. For example, if the RVD by visual estimation during the procedure is 4 mm, use a 3.5 mm diameter AngiosculptEvo catheter. For in-stent restenosis, select a catheter that closely approximates the reference vessel diameter. Using sterile technique, remove the appropriately sized AngiosculptEvo catheter from the package and place on the sterile field. Remove the stylet from the catheter. Then remove the protective tubing covering the AngiosculptEvo catheter balloon. Visually inspect the catheter to ensure all components are intact. Flush the guide wire lumen with saline by carefully inserting the distal catheter tip into the end of a 10 cc syringe. Inject saline until droplets emerge from the guide wire port. Attach a 20 cc syringe filled with 2 to 3 cc's of 1-to-1 mixture of contrast and normal saline to the balloon inflation port. Open the stopcock and aspirate air from the catheter balloon lumen. Maintain vacuum for 30 seconds. Close the stopcock and remove the syringe. Attach inflation device filled with 1-to-1 mixture of radiographic contrast and normal saline to the stopcock. Avoid introducing air bubbles into the catheter balloon lumen. Open the stopcock to the inflation device. Aspirate and lock in vacuum. All air must be removed from the balloon and displaced with contrast medium prior to inserting into the body. To activate the hydrophilic coating, wet the catheter's coated area with saline or wipe with the wet sterile gauze prior to insertion into the guide catheter. Avoid using alcohol, antiseptic solutions, or other solvents to wet the hydrophilic coating. AngiosculptEvo is now ready to be loaded over the guide wire and delivered to the target lesion. If there's difficulty advancing the catheter through the hemostatic valve of the introducer sheath, gently grasp the catheter with a wet, sterile gauze. When backloading the catheter onto the guide wire, the catheter should be supported, ensuring that the guide wire does not come into contact with the balloon. Do not advance or retract the AngiosculptEvo catheter over the floppy portion of the guide wire. Do not advance or retract the catheter unless the balloon is fully deflated under vacuum. If resistance is met during manipulation, determine the cause before proceeding. Inflate the AngiosculptEvo balloon per the following recommended protocol. Increase the inflation pressure by 2 atmospheres every 10 to 15 seconds until full device inflation is achieved. Do not exceed the rated burst pressure, RBP, printed on the package label. Apply negative pressure to the inflation device. Confirm that the balloon is fully deflated and remove. The catheter should be retracted only by grasping the catheter shaft. If there's difficulty removing the catheter, gently grasp the catheter with a wet, sterile gauze. Do not rotate the catheter shaft in excess of 180 degrees when the tip is constrained. Do not rotate the catheter lure hub in excess of 5 turns during use. Catheter manipulation, including advancement and retraction, should be performed by grasping the catheter shaft.